Today is World Mental Health Day, and it's a time to spotlight the importance of mental health so that we can continue to break down the stigma that surrounds it. This topic is especially relevant this year as the pandemic has brought a new set of challenges for those struggling with mental health issues. Colleen Rodriguez is the Executive Director of Jewish Family and Community Services. She's joining us now this morning to tell us how we can better promote our mental health and recognize any warning signs in ourselves and our loved ones and find resources in our community. Good morning, Colleen.
Good morning. Thanks for having me.
What is World Mental Health Day all about, and why is it especially important this year?
Really, it's a day for us to acknowledge that mental health is important, that we all have mental health. We talk about our physical health all of the time. This is a day to really say it's important that we are taking care of ourselves emotionally and that we're taking care of those around us emotionally. The pandemic has been extremely difficult, and as we're kind of inching towards maybe some normalcy, we need to acknowledge how it's impacted us in the past several years and how we're going to help ourselves moving forward.
And what can people do to better address their mental health today?
I think they have to pay attention to, are they feeling different? What does that look like? Are they sleeping the same? Are they eating the same? Are they interacting with people the same? Are they feeling disconnected? Having one of those things isn't alarming, but if you're starting to feel like there's a significant change in the way you're behaving, it's first acknowledging that maybe you need assistance. And then doing the same for those that you're living with and that you're interacting with.
And you mentioned loved ones. What can we do to help those that we might be concerned about their mental health?
You have to have the direct conversation. I've noticed changes in you. I'm worried about you. How are you? And really, a lot of times we ask people how they are, but ask and then actually wait and get a response. And then give them support. There's no judgment in needing help. We don't judge each other when we go to the doctor. There should be no judgment in seeking out mental health and helping our loved ones find that care that they need.
And you mentioned saying, are you okay? I mean, I know a lot of times our instinct when people ask us, are you okay? You just say, yeah, I'm fine. So how can we better approach someone specifically if we see some sort of change to make sure that they are okay or that they can speak about what they might be going through?
I think, again, it's being direct. You're saying that you're okay, but I've been noticing that you haven't been returning phone calls. You've seemed less interactive. I would tell them what you're acknowledging, what the changes you're seeing in their behavior. So it's not just, I'm going to accept it okay. And then if you can know some resources in your community to share with them, that's helpful as well.
And again, what are some specific warning signs that might be something that we should keep in the back of our minds and, take note of?
Sleeping, changes in sleeping, changes in eating, changes in mood, withdrawal, less interaction with others, not wanting to interact with others. Of course, if you're drinking more than usual or using substances, that can be a concern. So it's just a real change in the person's behavior from what they're normally like to how they're behaving now.
And what are some resources when someone does notice that something might not be right? How can people get help?
So Jewish Family and Community Services absolutely has a counseling department, over 30 therapists that will work with individuals, families, and couples. If they're not comfortable with that, then I would say seek help through your doctor. Many physicians will know other therapists within the community. You can go to your insurance. Insurance will tell you what therapists are covered by their plan. So lots of avenues of ways to seek help. United Way has 211, which is a resource guide for all services in Northeast Florida. That would be another avenue.
All right, this is great information. Thank you so much, Colleen Rodriguez, for joining us this morning.
Thank you.